Imagine you're standing in front of, like, a crumbling brick building. The mortar is turning to dust. The bricks are cracking.
Right. The whole foundation is just settling.
Exactly. And the traditional medical approach to fixing this kind of damage has basically always been structural. You bring in new
Or
bricks.
you prop up the walls with steel beams.
Right. You pump in cement to fill the gaps.
Yeah.
It's a highly physical, structural intervention.
It's patching the problem.
Totally. But what if, instead of bringing in all those outside materials, you could just stand outside that building, send a perfectly timed text message to the bricks themselves, and suddenly they just start rebuilding their own mortar?
I mean, it sounds like a concept from a sci-fi novel,
It
right?
really does.
But if you look at the vanguard of regenerative medicine right now, that is the literal paradigm shift we are experiencing. We are um, transitioning from crude structural replacement to targeted biological communication.
Well, welcome to the deep dive. Today, we are taking you into this rapidly evolving intersection of longevity medicine, cellular communication, and women's intimate health.
It's a fascinating space.
It really is.
Yeah.
We are looking specifically at the science of vaginal rejuvenation and remodeling, and we have a pretty dense stack of sources to guide us today.
Yes, lots of material to get through.
We've got clinical FAQ sheets, manufacturer data for advanced biologics, specifically a product called ASCE plus IRLV from ExicoBio, and some very candid open letters from practicing longevity physicians, like Dr. Trey from HealthLogic MD.
And having those varied perspectives is just critical. I mean, this field is notoriously noisy.
Absolutely.
And for anyone trying to navigate it, you really have to know how to filter the hard science from the marketing hype.
Which is exactly our mission for this deep dive. We're going to strip away the medical jargon to decode a really specific question that's kind of dominating this space right now.
Good dosage question.
Yes. What is the recommended total particle dose for effectively remodeling the anterior vaginal wall? And why does that specific concentration, which these clinics pinpoint at somewhere between 2 billion and 5 billion microscopic particles per session, why does that matter so much?
Well, it matters because in regenerative medicine, the mechanism is everything.
Right.
If you don't understand the how and the why behind that massive dose, you're really just throwing expensive treatments at a wall and hoping they stick.
Okay, let's unpack this. Because when most people hear about regenerative medicine, their minds immediately jump to stem cells.
Right, of course.
And usually they picture stem cell therapy as like planting new seeds in a garden. You inject the cells and those cells grow into the new tissue.
Which makes sense intuitively, but
Dr. Trey's letter makes it super clear that is not what's happening here. So I want to propose an analogy based on our sources. Exosomes aren't the seeds. They are the text messages the seeds send to the soil to tell it to repair itself.
I like that. And the biology completely backs that up. Exosomes are not cells. They are incredibly small, nano-sized envelopes. We call them extracellular vesicles, or EVs. We're talking 30 to 200 nanometers. They don't contain a nucleus.
Wait, no nucleus at all?
No nucleus, and they don't have DNA that will just replicate to become a new piece of cartilage or, mucosal tissue.
Okay.
They are secreted by cells like mesenchymal stem cells, but their entire function is purely communication.
So inside these tiny little lipid envelopes, they're just carrying a payload of instructions.
A very complex payload, yeah.
Wow.
We're talking about messenger RNA, proteins, enzymes, growth factors.
Oh.
And when they enter a target tissue, they fuse with the aging or damaged cells that are already there and essentially hand over a blueprint.
Like, here's what you need to do.
Exactly. They instruct the existing kind of dormant workforce to wake up, reduce local inflammation, and basically coordinate their own repair.
The local workforce suddenly remembers how to do their jobs the way they did like 20 years ago.
Precise.
But to understand why the 2 to 5 billion dose matters, we really have to look at where these messages are being sent. The vaginal environment is a uniquely complex biological battlefield. It isn't just regular skin, right?
Not at all. I mean, the structure of the intimate mucosa is fundamentally different from the skin on your arm or your face.
How so?
Well, facial skin has a tough, protective outer layer of dead cells. It's called a keratin layer. The vaginal mucosa lacks that keratin shield entirely.
Oh, really? No keratin at all?
None. It's composed of 20 to 30 layers of non-keratinized stratified squamous cells, and the entire structure is incredibly paper thin. We're talking only 0.2 to 0.5 millimeters thick.
Okay, but if there is no tough keratin barrier blocking the way, shouldn't it be super easy to just, rub a restorative cream in and be done with it? It sounds like it would act like a highly absorbent sponge.
You would assume so, yeah.
Yeah.
But that lack of a barrier actually creates a totally different problem. It is a uniquely hostile environment for topical treatments because it is constantly flushing itself.
Huh.
It exists in a near 100% humidity environment. It's constantly producing natural fluids and tissue exudate.
So it just washes everything away.
Exactly. If you apply a standard cream or gel, it just gets washed out before achieving any meaningful cellular penetration. And furthermore, when women experience intimate dryness or atrophy, that moisture loss isn't caused by air evaporation like on your face.
Right, because of the humidity. So what causes it?
It's caused by the physical thinning of the epithelial tissue itself and a breakdown in the tiny blood vessels, the microcirculation that actually feed it.
Okay, so you have this really fragile, starving tissue that desperately needs blood flow, but it's constantly washing away any topical help you try to give it.
Exactly. It's a massive challenge.
That have to be a dosage and delivery engineering problem. And the sources point out that manufacturers like Exoco Bio really had to solve this to make their biologic work.
They did.
Because to remodel the anterior vaginal wall, these clinical preparations recommend a massive payload. Like we mentioned earlier, a total particle dose of 2 billion to 5 billion extracellular vesicles per session.
It is a staggering concentration. Clinics are looking at particle concentration counts of 10 to the 10th power, 10 to the 11th power EVs per milliliter.
That's a lot of zeros.
It is. But that's what's required to achieve true regenerative signaling capacity in that specific mucosa.
Here's where it gets really interesting to me.
Huh.
5 billion sounds like an absurdly high number. My first thought is this just a numbers game?
What do you mean?
Like, are they just throwing overwhelming volume into the tissue, assuming that if they flood the zone, a few particles will miraculously survive the body's flushing mechanism?
Well, what's fascinating here is that the high dose isn't an accident, and it's not a guess. It is a highly engineered necessity. You have to remember that constant fluid wash we just talked about.
Right.
To combat that, these 5 billion particles aren't just floating aimlessly in a vial. They are engineered with a specific negative electrostatic surface charge, specifically around negative 30 millivolts.
Wait, a negative charge? Are they essentially weaponizing static electricity?
Essentially, yes.
Because if the mucosal tissue has a positive charge, these particles are going to snap together.
That is the exact mechanism. The glycoproteins sitting on the surface of the mucosal cells have a positive charge. So when you introduce this massive dose of negatively charged nanocarriers, they achieve electrostatic absorption.
Wow.
They act like microscopic magnets. They lock onto the mucosal surface instantly. This magnetic Velcro prevents the exosomes from being washed away by the natural fluids.
That is brilliant. So they aren't hoping they stick. They are magnetically anchoring themselves to the tissue.
Exactly. But the Velcro effect is only the physical delivery. The chemical delivery mechanism requires just as much engineering. You can't just drop 5 billion particles into this environment in any old liquid.
Right, because of the sensitivity.
The formulation has to use a weakly acidic muffer, somewhere between a pH of 3.8 and 4.5. And the fluid density, the osmolality, has to be perfectly calibrated, usually between 280 to 320 millismoles per kilogram.
Okay, I imagine if you used a neutral pH, like a standard facial serum or a liquid that was too dense, it would cause absolute chaos down there.
It would nuke the local immune system.
Literally nuke it.
Yeah. A standard neutral pH facial product would instantly spike the local pH and kill off over 50% of the vital lactobacillus bacteria in the vaginal microbiome.
And we need those.
We absolutely need them. Lactobacillus is the primary defender of that environment. It needs an acidic environment to ferment glycogen. And by fermenting glycogen, it produces hydrogen peroxide.
Wait, hydrogen peroxide, like the stuff in the brown bottle?
Exactly the same chemical naturally produced. The body maintains it at about 1 to 5 parts per million to create a localized defense zone that prevents bacterial and fungal infections.
Okay, so the manufacturers are precisely engineering the fluid density to match the body's natural state so they don't shock the cells, while strictly buffering the acid levels to keep the hydrogen peroxide shield intact.
Exactly.
And all of this is just to safely deliver the payload.
You have to respect the physiological pressure in the microbiome, otherwise your treatment just causes a whole new disease state.
Okay, so we now have a recommended dose of 2 to 5 billion negatively charged acid-buffered text messages magnetically clinging to the mucosa. What actually happens once they bypass that superficial barrier?
Things move very quickly.
Yeah, the timeline in the sources indicates they descend deep into the tissue layers in a matter of minutes.
Yes, specifically because of that electrostatic binding and the optimal sizing, they descend about 2.5 millimeters into the lamina propria in just 15 minutes.
15 minutes.
Right. And their targeted absorption efficiency is measured at roughly 300% higher than conventional topical gels.
That is wild.
And once they are in the deep tissue, we see a profound cellular cascade triggered by this massive dose of EVs. First, the exosomes instruct the body to upregulate vascular endothelial growth factor, or VEGF, by about 45%.
So they're telling the body to build new blood vessels.
Yes, promoting angiogenesis. The shrunken submucosal capillary networks begin to dilate, and microcirculatory blood flow increases significantly, usually by around 20%.
Okay, and remember earlier when we noted the tissue was starving for blood.
Right.
So this accelerated blood delivery brings a massive surge of nutrients.
Exactly. The aging cells expand, and their intracellular water content is fundamentally restored, returning to about 70%.
It's literally rehydrating the cells from the inside out, rather than just slathering a temporary lubricant on the outside.
And it goes far beyond hydration. These exosomes contain signaling molecules that stimulate the fibroblasts to accelerate collagen synthesis.
The structural protein.
Right. As we age, the ratio of different types of collagen degrades. But over a treatment course with this 2 to 5 billion EV dose, the exosomes signal the fibroblasts to synthesize type 1 and type 3 collagen, flipping the ratio back to a youthful 4 to 1.
Wow.
The cells restock their energy reserves, and structurally, the actual thickness of the epithelial layer is restored by over 40%, bringing it back to over 0.35 millimeters in just 14 days.
14 days. That's incredibly fast for tissue remodeling. So what does this all mean?
Well, clinically,
Because when you are the patient sitting in the clinic, you aren't feeling your vascular growth factors go up. You aren't measuring your collagen ratios. What is the tangible outcome for the person actually receiving this?
the clinical outcomes are striking because you are addressing the root cause of the discomfort. By restoring the tissue thickness and the natural lubrication from within, mucosal friction drops dramatically by about 0.4 in studies.
That's a huge relief for patients.
Absolutely. For women experiencing dyspareunia or pain during intimacy, clinical pain simulation scores dropped significantly. Overall vaginal health index scores, or VHI, jumped by 4.5 points on average. And this happens even for women with severe estrogen depletion.
That's such a crucial point for women who cannot take local estrogen, like maybe due to a history of hormone receptor positive breast cancer or medically induced menopause.
It's a game changer for that demographic.
It really is. This is signaling the tissue to repair itself without introducing any outside hormones. Now, I want to contrast this biological approach with the structural options we mentioned at the very beginning, the bricks and mortar approach.
Okay.
If a patient is looking at a hyaluronic acid filler, an HA filler, for the anterior vaginal wall, how does that actually compare to this massive exosome dose?
It is the difference between a structural scaffold and a biological reset. Hyaluronic acid fillers provide immediate physical volume. They cushion the tissue, which, mechanically reduces friction trauma.
Right.
But they are inert. They do not change the underlying cellular health. Over time, enzymes in the body break that filler down, and you just have to keep replacing the drugs.
And fillers carry mechanical risks, right? Like physical migration or blocking a blood vessel.
They do. And the same goes for surgical threads, which provide mechanical tightening by pulling the mucosal walls. It's purely structural.
Yeah.
Exosomes, however, fundamentally alter the extracellular matrix. They actually send signals that downregulate the tissue-destroying enzymes, like MMPs, that break down atrophic mucosa in the first place.
So they aren't just adding volume. They're stopping the biological wrecking ball from swinging.
That's a perfect way to put it.
Well, this all sounds incredibly promising, which means I think it is time for a reality check. I want to bring Dr. Trey's open letter back into the conversation here. She makes a very stark distinction about the regulatory realities of these treatments.
And this is an area where consumers really need to demand transparency. Exosomes used in reputable clinics are heavily FDA regulated in terms of how they are sourced, handled, screened for diseases, and processed for safety.
They are safe.
Yes, but they're not FDA approved as a drug to treat or cure any specific disease. In the context of Exicobio's AOCE plus IRLV, it is classified strictly as a cosmeceutical and aesthetic product.
Right. Dr. Trey put it bluntly. If a physician claims this is a standalone miracle cure without addressing your nutrition, your pelvic floor, or your overall metabolic health, they are basically selling snake oil.
She is spot on. They are not a miracle cure. Regenerative medicine is one tool in a broader longevity plan. If a patient comes in hoping a 5 billion particle dose will fix everything without addressing their systemic health, they will be disappointed.
Yeah.
Furthermore, this shouldn't replace standard medical care. If a patient has severe symptoms like unexplained bleeding or active infections, they need a full medical evaluation, not an aesthetic biologic.
That makes perfect sense. Let's talk about how these exosomes are actually deployed in clinics then, because the manufacturer guidelines show they are rarely used in isolation.
No, almost never.
They are heavily utilized in synergy with energy devices, like lasers or radiofrequency treatments. Now, those devices work by creating controlled thermal damage, right? Like heating the tissue to shock it into a healing response.
Exactly. And if we connect this to the bigger picture, energy devices have been the gold standard in aesthetic gynecology for years.
Right.
By heating the dermis to around 65 degrees Celsius, you force the body to mount a repair response and produce new collagen. But that thermal shock creates a massive inflammatory cascade.
You are basically setting a controlled fire to clear the brush, but you are leaving the tissue angry, red, and swollen.
And this is exactly where the 2 to 5 billion exosome dose proves its worth. Applying this massive payload of EVs immediately post-procedure acts as an instant anti-inflammatory brake. The exosomes carry repair proteins that rapidly block that inflammatory cascade. They drastically drop the concentration of pro-inflammatory cytokines like IL-6 by about 40% within just 24 hours.
It doesn't just stop the swelling either. The sources describe a fascinating biological event called the phenotypic switching of macrophages.
This is arguably one of the most elegant mechanisms we've covered today.
I agree, it's so cool.
Macrophages are white blood cells that act as the body's cleanup crew. When tissue is damaged by a laser, macrophages rush in. By default, they arrive in a highly aggressive, pro-inflammatory state, which is known as the M1 phenotype.
The angry state.
Exactly. The exosomes essentially send a signal that forces these macrophages to flip from that angry, inflammatory M1 state into a calming, reparative M2 state.
It's like the exosomes show up to a riot, hand out hard hats, and turn the rioters into a construction crew.
I love that analogy. That perfectly captures the cellular dynamic. And by flipping the macrophages and calming the inflammation so quickly, they also suppress the activity of the cells that produce pigment, the melanocytes.
Okay, why does that matter?
Because this effectively blocks post-inflammatory hyperpigmentation. It significantly reduces the risk of the tissue darkening after a laser treatment.
Oh, that's huge.
Yeah, you get all the collagen-stimulating benefits of the heat therapy with a fraction of the downtime and risk.
It is an absolute masterclass in cellular hacking. So to bring this all together and answer the core question we set out with today, remodeling the anterior vaginal wall isn't just about propping it up with structural fillers or burning it with a laser and hoping for the best.
No, it's not.
It's a high-tech biological conversation. And to make that conversation happen in an environment that is constantly trying to wash you away, it requires a highly calculated dose.
Right.
You need those 2 billion to 5 billion electrostatically charged, acid-buffered exosomes to act as magnetic Velcro.
Exactly.
They break through the mucosa and trigger an inside-out cellular reversal.
And the takeaway for you, listening to this, is that true intimate wellness requires filtering out the hype from the hard science. You need to demand transparency from your providers.
You really do.
When a clinic offers a regenerative therapy, you need to know not just what they are selling, but the exact mechanism. What is the particle dose? Is the fluid density and pH correct for the target tissue? Are they offering a scientifically grounded tool as part of a comprehensive health plan, or are they just selling hope?
Because knowledge is your best defense against the noise. Which leaves us with one final thought to ponder. We started by imagining a crumbling brick building and realizing we could send a text message to the bricks to heal themselves.
Right.
If we can successfully engineer a perfectly timed, highly concentrated payload of 2 to 5 billion cell-free signals to bypass the body's natural flushing mechanisms, magnetically bind to tissue, and remodel the vaginal wall without using a single hormone, what other hidden aging microenvironments in the human body are just waiting for the exact right text message to heal themselves?
It's a profound question. I mean, the applications of this kind of biological communication are really just beginning.
We'll see you next time on The Deep Dive.